Body could tell you what it needs to be healthy. What would it say? More water, a change in diet, supplements maybe? Well, when it comes to optimum health, your body can tell you what it needs, but how do you talk to your body to find out what it is? Dr. Judy Marchiol, a chiropractor and acupuncturist from Ascent Health Center, joins us live this morning to explain. So this is pretty, out there for some people.
Right.
Okay, so what exactly, good morning, by the way.
Good morning.
What exactly does it do?
So this is one of the many tools we use in our office to assess what's going on in a patient's body. Especially now, people come in with a wealth of information. So we use this in our office in conjunction with lab tests and information that they bring in just as an extra tool.
Okay.
What this does is it sends information from the computer to the handheld cradle
Okay.
and into the system.
Okay.
And that stimulus measures in the cells whether the cell is expanding or contracting. That then gives a positive or negative response, which the program graphs. As it graphs that response, it looks at stress on organ systems, acupuncture meridians, the teeth, and the spine itself.
So what problems would you be able to ascertain a person had with this, and then what kinds of things do they take? Is it naturopathic things like supplements and, like you said, more water, things like that?
So what this does is this looks at a particular subset of nutritional supplements. And based on the information it receives from your scan, it determines which nutritional supplements would most benefit the condition that your body's experiencing.
Okay.
So instead of coming in and not knowing where to start with nutritional supplements and just going off of the patient telling you how they feel, we put this in combination with other lab tests or lab tests they bring in from their medical doctor and come up with a nutritional program that they can start on and follow through with that's specific to what their symptoms may be. Instead of just going off of a diagnosis, we can really fine-tune it into what that patient is experiencing.
So you take their medical records into consideration as well as this and how they're feeling and their symptoms that they're telling you about.
Right. So it's just one tool that we use in the
several.
office.
And how long has this been around?
So interestingly enough, this is new technology for Zyto. But this has been around, and we used in our office something called a body scan, which was actually, the concept was developed back in the 1900s with Dr. Vole and the voltmeter. So he started by measuring on a voltmeter resistance in the body.
Interesting. And how long have you been using this?
We've been using this just a few months now.
Are you happy with it so far?
We like it.
Yeah, you do.
And it's got a huge expansion. What we're testing are organ systems, but you can look at bugs, emotions, because emotions have that stress associated with them too, and really dig into why someone isn't feeling good.
And if someone wants to come in and get this test done, how much does it cost?
So this is part of our overall exam, and when they come in as a new patient, we include it, but we have people, because we're in that town center on the strip, that come in just to do the scan, and we charge $50.
To do the scan. Well, thank you, doctor. It's interesting.
Absolutely.
An additional tool to help figure out what exactly may be wrong with you.
Right.
Well, thanks for coming in, and we'll have a link to your website on our website as well.
Thank you.
All right, she's